Hello, this is Christina Trotter from Maryvale University. This is my son Peter Winfrey, who's going to assist me for my head-to-toe assessment video. I washed my hands. I've had Peter change into a gown. I've had him empty his bladder. He's had a full height, weight set of vitals done. I've assessed his near vision with the Jaeger chart and the distance vision with the Snellen chart. From now, I'm going to start with the cranium area. I'm going to first begin by assessing. I'm going to note the color and texture of his skin. I'm noting no lesions or abnormalities. His facial features appear to be symmetrical. His ears are lining up with the inner canthus of his eyes, giving symmetrical presentation, and appears midline. I'm going to next go to palpation. I'm going to start with the frontal bones of the face, moving around the jaw areas, noting for any deformities, areas of tenderness. I'm going to palpate the maxillary sinuses and the frontal sinuses, looking for any discomfort, which he does not appear to have. Hair is equally distributed, no areas of alopecia noted. It is soft, and his skin again is warm, dry, and intact. I'm next going to move to the assessment of his lymph nodes, starting with the posterior occipital. I'm going to move to the postauricle, the preauricle, the tonsillar, the submandibular, and the mantle. Next I'm going to the posterior cervical chain and the superficial cervical chain, to the supraclaviculars, subclavicular, supporting his arm to the axillary. Good, thank you. Now from there I'm going to move up here, and I'm going to have him open his jaw, move it side to side, and close your mouth. I'm assessing the TMJ, the temporomandibular joint, for clicks, pops, grinding, which he doesn't have any. Grit your teeth, please. Good. This is an assessment of his masseter muscle, which is also cranial nerve number 5. I'm going to continue to assess number 5. Do you feel these equally?
Yes.
Good. Okay, that is assessment of cranial nerve number 5. Now I'm going to move into the rest of the assessment of the cranial nerves as long as I am at the head region. Okay, beginning with cranial nerve number 1, which is olfactory. I'm going to omit this part of the exam for time constraints, but if I was going to do it, I would have him occlude one nostril and present him with an odor such as a coffee or a banana and see if he could discern it and do it bilaterally. By doing this, I'm also demonstrating nasal patency, breath in, through your nose, and again, and he does have some nasal patency with a little bit of congestion. Moving on to cranial nerve number 2. This is the optic nerve. We're going to assess the visual fields. Optic number 2 is responsible for central as well as peripheral vision. Could you please cover your left eye? Okay, and I will cover my right. And you tell me when you see, look directly at my eye, and tell me when you see my finger coming in.
No.
Okay, and other eye?
No.
Good, okay. Now, feel the gaze. Accommodation. Extra. Cover your left eye. How many fingers do you see?
2, 2, 5.
Other eye, please.
2, 2, 3.
Great, okay. Now moving on to cranial nerves number 3, 4, and 6. 3 being ocular motor, 4 being trochlear, and 6 being obtusans. These can generally be assessed together. I would be grabbing a pen light, and I would dim the light, and what I would do then is to have him look directly at my finger and assess pupillary response. While I'm doing this, I'm also noting that there's no ptosis in the eyelids. They're clear. Now could you follow my finger? Assessing the 6 cardinal fields of gaze. He's tracking adequately, and he is not exhibiting any signs of nystagmus. Moving on, we've done number 5. We're going to move to cranial nerve number 7. Could you puff out your cheeks? Smile, frown, real mad, scrunch up your face, great. Okay, and 7 could also continue to be assessed by discerning tastes on the rear posterior portion of his tongue. Cranial nerve number 8, it's auditory. I'm going to walk to his side, and I'm going to whisper a word and have him repeat it.
Red.
And on the other side.
Blue.
Excellent. Okay, proceeding to cranial nerves number 9 and 10, which is your glossopharyngeal and your vagal. We're going to have him open his mouth. Sorry, I forgot my pen line. We're going to have him open his mouth again. I am looking for that palate to mid-rise and the uvula to be midline, which it is. And then real quickly, and I'm going to, yep, he's got a gag reflex. So those have been assessed. We are now moving to cranial nerve number 11, supraspinous. Can you shrug your shoulders, please? Excellent. Now move your head against this hand. A little pressure. This way too. Excellent. And move your head forward and back. We've also established that he has good range of motion with his neck. And then last but not least would be cranial nerve 12, which is hypoglossal, and have him stick out your tongue. Now swallow. Excellent. And I've noticed by speaking to him that he doesn't have any problems with articulating speech and that he swallows adequately. These are assessed by cranial nerve number 12. Those are our cranial nerves. I am now going to move on to assessment of his ear. And I'm going to start the ears by inspection, which I'm looking at as the auricles, the pinna. I'm noticing, I've already noticed the symmetricals. Outside does not appear indurated. There's no redness, no flaking. I'm going to palpate them. No tenderness. And then I'm going to look inside of his ear. And I am noting, I can see that his tympanic membrane is pearly gray, the red light reflex is present, the walls are not indurated, there's mild wax buildup. I'm going to do the same thing with the other side. I'm going to palpate the ear, the auricle. There's no tenderness, noticing that there's no induration, no redness, no flaking. Again, looking inside the ear, and I can see the tympanic membrane. That is intact. I can see the red light reflex. The walls do not look irritated, which is good. Now, continuing along with the ear, I'm going to assess his hearing. I'm going to do it by the Tyne and the Weber test. And we're going to start out by, I'm going to see if he lateralizes. So I'm going to put this on top of his head. Do you hear it equally?
Yes.
Okay, tell me when you stop hearing this.
No.
And now?
No.
It's about a 2-to-1 ratio air to bone conduction, which is good also. Doing the same thing here.
No.
And
No.
excellent. Okay. Good. Okay, moving on from the examination of his ears, I'm going to go to the eye examination. We have completed some of the eye examination by doing some of the neurological tests, but we're going to do the cover and uncover test as well. First, I'm going to begin by inspection of the eye area. I'm looking at his eyebrows. There's symmetrical presentation as well as eyelashes. I'm not noticing any flaking, any crusting. The hair distribution is good. He doesn't have any eyelid droop. He doesn't have any irritation or exudates of the eye noted. Then I'm going to palpate the entire eye orbit area and the lacrimal apparatus. Again, that looks very good. And I'm going to have you look down for me, and then look up, and again, down, down, and up. And what I'm looking for is his sclera is clear and white, and the conjunctiva is mildly pink, looks good. From there, I'm going to have you, I want you to stare at my finger and cover your right eye. Okay, now uncover, good, and one more time, good, and uncover. And move to the other eye. Uncover. And one more time. Uncover. Excellent. I'm looking at the cover and uncover test. I want to see how that eye tracks, the covered eye tracks back to the point that I'm having him stare at. And there's no nystagmus, there's no drift, which is a good positive finding. So this time we've done the near, we've done the far, we've assessed the visual fields. So we're going to move on to the nose. And what I'm looking at is I'm, again, looking and inspecting first. I don't see any redness, no induration. I'm looking for symmetrical. His septum does appear to be mildly deviated to the right. I'm going to, again, palpate the sinus areas, the maxillary, and the frontal, looking for any areas of tenderness, which I do not appreciate. And I'm going to look up into the turbinates, and they are mildly reddened and boggy, but it's typical with allergies. No crusting, no areas of scabbing noted. And as per the cranial nerve assessment, the olfactory nerve could be assessed by doing the smell test, and we did establish nasal patency. Moving to the oral area, I am noticing that his lip is symmetrical. His lips are pink and moist. They do not look cracked, dry, or irritated. I'm going to have him open his mouth, and we're going to look in. And we're noticing that he does have positive rise of the palate. And I'm looking at the hard palate, the soft palate, the tongue, underside of the tongue, please. Good. The buccal mucosa, I'm noticing the teeth and their distribution, their color, and we've already checked for the gag reflex, so I won't torture him again with that. And there's no irritation or sores noted in his mouth. Next, I'm going to move down to the neck. Again, with inspection, I am noticing that he's got a little redness on his skin, probably from a little bit of a shaving burn. But outside of that, the skin does look intact, warm, dry. His trachea appears midline, and I'm going to feel for midline, which it is, down to the notch, and I'm going to palpate his carotid artery on both sides. Excellent. And then I'm going to listen to his carotids. I'm going to auscultate to see if there's any bruise, so take a deep breath and hold it. Excellent, exhale. And then I'm going to listen to the thyroid. Okay. And then, last but not least, I'm going to palpate the thyroid cartilage. Just placing it slightly to the right, I'm going to ask him to swallow, please. And it is nice and smooth. And it moves with ease. So moving from there, I am going to have him turn towards the wall, please. Hopefully you can see this. And I am going to first begin with inspection of the back. And I'm looking and I'm noticing that he does have, his skin is warm, dry, and intact. His respirations appear non-labored, easy. There's normal hair distribution on the back, and I'm not seeing any struggling. So I'm going to put my hands on his thorax. I'm going to notice that he does have nice, equal respirations. And then I'm going to bring my hands up, and I'm going to have him, I'm going to perform tactile fremitus. Could you please say 99?
99.
Again?
99.
Again?
99.
And again.
99.
Excellent. Okay, and then again?
99.
Again?
99. 99.
Excellent. Okay, before I begin percussion, I'm going to measure the diaphragmatic angle. Peter, could you please cross your arms in front of you and lean forward just slightly? Okay. Now, what I would like you to do, I'm going to start in the hip area, I'm going to move up, and I'm going to percuss. Take a deep breath in. Hold it. Good. And I'm looking for the angle where the sound changes. I'm going to mark it off. Exhale, and have a couple of breaths. And then I want you to take a breath in, let it all out, and now hold your breath. And it's supposed to be 3 to 5 centimeters, which it's right in that area. Okay, great. And I normally would do that on both sides, however, for time constraints, I'm not going to do that, but you want to make sure everything's equal. Next, I'm going to do some percussion, going to the bottom of the, you can uncross your arms and sit relaxed now, thanks. I'm going to do some percussion down the costovertebral angle, which is right here. I'm noticing if he's having any pain or discomfort while I'm doing this. And he does not seem to. From there, I'm going to move to percussion. I want to make sure that I do everything laterally, so in between the I am looking for any areas that sound dull, which I'm not appreciating. And then could you raise your arm up for me, please? And then this one. Okay, so I've done my palpation, I've done equal, so now I'm going to listen to his breath sounds. In through your mouth, please. Nice deep breath. Good. Again. And nice and clear. And then I'll have you raise this arm up, please. Laterally, deep breath. Excellent. This side. Excellent. Okay. I'm assessing all his breath sounds are clear bilaterally. There's no adventitious breath sounds, and he's got good air movement. So I'm going to continue the respiratory assessment by having him turn around towards the front of the table again. Okay. Again, I am assessing, I'm looking at his chest, I'm watching how it raises and falls, and I did note too, when moving from side to side, that his AP diameter does appear to be a 2:1, which is normal. I'm noticing he's got regular relaxed respirations. I'm seeing no tracheal tugging, no signs of distress. And again, I'm going to use tactile fragmatus. 99, please.
99, 99, 99.
Excellent. Okay, and I'm not appreciating a tactile fragmatus. So from there, I will continue. I'm going to percuss, and then I'm going to oscillate. And he is muscular on the top, so it's percussing with a little more force. And now I'm going to oscillate, and you can just breathe relaxed. Excellent. Okay, and from now I'm going to move along to the cardiac portion of his assessment. I'm going to start out here at his hands. I'm going to do a capillary refill, which is brisk at less than 3 seconds. His hands do not appear edematous. He's nice and pink. Radial pulses are equal bilaterally. Do some brachials. Nice strong brachial pulses. And then I'm going to move up to the cardiac area itself, the precordium. I am looking for lifts, for heaves, for any extra movements in the cardiac area. And I'm not appreciating any. And I'm also noting that I do not see any JVD, no jugular venous distension. Then I'm going to go ahead and I'm going to palpate the precordium. I'm again now feeling for any heaves, any lifts, any thrills. And I'm going towards the apex, the PMI. Excellent. Okay. Now I'm going to move on to the auscultation of the cardiac area, beginning with the pulmonary, with the aorta, excuse me. Pulmonary. Erb's point. Tricuspid. And last but not least, our mitral area. There we go. Okay. Now, if I was having difficulty auscultating these sounds, I could ask him to lay to his left side, and I could take advantage of that to get the heart shift over in the chest so I could actually hear those sounds better. I could also repeat the entire sequence that I just did with the bell of my stethoscope to appreciate for any other high-pitched noises. I'm hearing nice, regular rhythms, no clicks, no rubs, no murmurs, which is what I want to hear. Okay. From here we are going to move Peter into the part of the abdominal assessment. I'm going to have you lay back. There you go. You grabbed the wrong handle. Okay, part of the abdominal assessment, I'm going to go ahead and leave the camera at this angle. I think it's better to appreciate the abdominal exam. Again, I'm going to start out with just some visualization. I'm inspecting the abdomen. I'm going to get right down to the angle of the abdomen itself and shine the light across it. And I'm noticing that there's no abnormal bumps or areas that look like there could be tugging or something, and there's not. So from here, I'm inspecting. The skin looks pink, warm, dry, intact. It looks good, and I'm not appreciating any areas of abnormalities. From there, I'm going to auscultate all 4 quadrants of his abdominal area, listening for bowel sounds. Good. Excellent. Okay, he has bowel sounds. If he did not, I could actually spend 3 and up as long as 5 minutes in a given area if I was not hearing bowel sounds. From there, I'm going to move on to percussion. I'm going to percuss the splenic area. What I'm looking for whilst percussing the splenic area is I am looking for a sound of dullness, which would indicate an enlargement of the spleen. So I'm going to find the bottoms of his ribs. And I'm going to start from an area of tympany and work up. Extend along thoracic border, looking for any changes and I'm not appreciating it. Good. I'm also going to do the same thing with the liver border. I'm going to start just lateral of the umbilicus, and I'm going to go upwards toward the liver. Noticing, starting in an area of tympani, coming toward the liver area, and then I will also extend up into the thoracic area. And I'm not appreciating any changes. And I don't hear any changes. To backtrack before I actually exit into the palpation, I do want to listen to his aorta and his other arteries. So we're going to start by oscillating the aorta. Good, the renal arteries. The iliacs. And the femorals. Good. Okay. Now I'm going to move on to palpation. I begin with light palpation, looking for areas of masses, any deformities, and also noticing if he's got any areas that seem to be uncomfortable. With light palpation, at this point I can also lightly palpate to see if I can feel his aorta, which I cannot. Now I'm going to move on to deep palpation, and I'm going to find the border of the spleen, and what I'm going to do is I'm going to reach over here, I'm going to push in and see if I can't find that spleen. Not really expecting to, and I cannot find it. I take advantage of being on this side as well to see if I can get a hold of that left kidney. And I can't feel the kidney. Okay, so then we're going to move over to the liver area, and I'm going to continue with the deep palpation, going up to the liver area to see if I can appreciate the liver borders, which I cannot. And then I want to deeply palpate down around the abdominal areas, and he's not exhibiting any signs of pain. Then I will move around to the opposite side and palpate for his right kidney. I do not feel the right kidney, which is good. Okay. At this time, I'm going to ask you just to pick your head up, there, and fold your hands on your stomach and pick your head up. Good. That just begins the portion of my musculoskeletal system, which is lets me know that has good abdominal strength. Please sit up. Alrighty. Okay, so we've already assessed the neck region for range of motion and for his part of the cranial nerve assessment. Anyway, we're going to start out here. I'm going to notice his musculature. I'm going to visualize. I'm going to notice that the skin on his arm is pink, dry, intact. The hair distribution is expected. I don't see any areas of dryness, chafing, or irritation. And if you feel everything equally, excellent. Shoulders, they're nice and muscular, good muscle tone, all the way down. Could you grab my fingers for me, please? Now give me a good squeeze. Good. Now pull me into you. Push me away. Okay, now push my hands away. Push my hands together. Excellent. Demonstrates very good muscular strength. Raise your arms to the side, please. All right, and now just rotate a bit. Good. Excellent. Okay, he has good range of motion of the upper extremities. At this point, I'll go ahead and test out his reflexes before moving on to the lower extremities. I'm just going to have you relax. a bit. Excellent. I'm going to be finding a cubical space, doing the brachials, and move down here. Sorry. And what I'm looking for is the response. Excellent. And again, about 2 inches above the wrist area. Good reflexes. Brisk, +2. Moving down, I'm going to go to the lower part of his examination. I will be moving the camera so you can appreciate the lower portion, but I'm going to start here by assessing, same thing, color of the skin, hair distribution. He has this pink, warm, dry, intact. I'm not seeing any areas of irritation. I'm palpating the quadricep area. His legs look very strong. Could you raise against my hand, please? Just raise your knee up like this. There you go. And the other side? Excellent. Now push my hands away. Pull in. Great. He's got good strength. And then I'll do the same thing on the calf. I'm going to have him push up, pull back against my hand, push up, pull back against my hand. Excellent. I'm going to move the camera angle here so you can better appreciate the feet. Okay. And what I did is I had him press against my hand and then pull back to demonstrate strength. And then what I'll have him do is some dorsiflexion, push up against my hand, please. And again. Now I press down. When I do the feet, I always take opportunity to check out the bottoms of the feet. This is really important for diabetic patients to make sure there's no cracks, blisters, or areas of concern. At this time, I will also be palpating for posterior tibial pulse, which are good, and dorsal. Yes, excellent. Good. Excellent. Okay. And I'm going to be assessing patellar. And that's Prescott +2. Excellent. And then last but not least, I'm going to grab the Achilles reflex. Good. And the Achilles reflex. I could always do a Babinski, which I was not expecting to be positive anyway. Okay. And I noticed down here too, there is no edema. I'm not seeing in either ankle or any tissues. Calf refill and his feet are really good. Yeah. I move the camera again on you. And now I'm going to have him stand. Okay. This helps us to finish off our neuro assessment. I'm going to do a Romberg technique. I'm going to have him close his eyes. And then I'm going to have him put his arms out to the front. Always supporting the patient. And I'd continue to do this for a minute or so. And then go ahead and put it down. Excellent. So I'm not seeing any issues there. Also, at this point in time, although I will not be having him doing it due to the space and time constraints, is I could have him walk across the room to assess his gait, his balance, have him stand on one foot, and then have him stand on another. I could have him heel walk, toe walk, and all this would be to assess his balance and coordination and neurological status. But right now we're going to continue, we're going to have him turn towards the wall, and I'm going to be looking at his cervical spine area. Everything looks nice and straight. I can palpate down his spine while he's standing, and then could I just have you bend forward at the waist, please? Keep going a little more forward. Thank you. And what I'm looking for here is I'm noting that his spine is midline. It does not curve. There's no scoliosis. It looks good. Thank you. You can stand up. Also noticing when he's standing from a musculoskeletal standpoint, do his hips appear even? And they do. And that's about it. And so at this point I have concluded my head-to-toe assessment video. Again, Christina Trotter from Maryvale University, my son Peter Winfrey. Thank you. I hope I covered all my points.